welcome back to our first segment. Welcome back to Open Your Eyes. We're about to jump on into a convo with the KHMH Laboratory and Laboratory Week. Now, in to tell us more about what they've got is Dr. Geraldine. All right, so that's Dr. Geraldine Morazan. All right, she is a Director of Laboratory Services at KHMH Lab. Okay, there we go. There we go. We're just making it right. We also have Elwin Rodriquez, who is a Supervisor, Chemistry, KHMH Lab again. Wrong again?
Central America Laboratory.
Andrea Makin, she's a Supervisor. I got that correct, right? There we go, guys. Good morning. It's so nice to have you in, and welcome.
Thank you very much. Thank you for having us.
Yes. You know, I am sure you guys saw the reaction from both of us when we heard the word needle and having to be pricked to extract blood. It's something that a lot of folks I can't say that we're not privy to it. I'm just, we just can't appreciate it, and I think that's the word that I will stick with. And it brings me into Laboratory Week, or let's talk about what we've got, Doc.
Well, a laboratory week is for the medical laboratory professionals to celebrate their profession and to make the awareness to the public of how important the job that they do is for all of us. Mm-hmm. And so it's a worldwide celebration for April 22nd to April 27th for this week.
What all does laboratories skills include? What all does it cover that we might not as the public appreciate?
Well, for the professionals, for the medical laboratory professionals, we have phlebotomists, people who does the blood draw, people who, the medical laboratory technologists who actually run the tests, and we have hematology samples, chemistry samples.
What is hematology?
Mm-hmm. Hematology is when you draw your blood, you investigate your blood components. Mm-hmm. So it investigates how well is your red blood cells, your white blood cells, your hematocrit, because the blood functions as a carrier for your oxygenation to your brain. Mm-hmm. So if your blood levels are low, you're not getting oxygen to your whole body, and especially to the brain. Yes.
And how has laboratory science evolved? I mean, what have been the advances in laboratory technology over the years? And is Belize anywhere close on the map compared to the international community?
Well, I believe that Belize is up the part even to the region, to say. At Central Medical Lab, as Dr. was explaining, we have different units that specialize in the different areas of the laboratory. She was mentioning hematology. We have chemistry, which deals with the chemistries of our blood that we find in our blood, such as glucose, cholesterol, trig, these things that we know. Serology, which are the different infectious diseases. We have the microbiology unit, we have the parasitology unit, all the units that you would find in a well-developed laboratory. And molecular. We are molecular. Also, one of the new units in our central lab is the molecular biology unit, which deals with the replication of DNA and to find different strands of diseases. So we are constantly on quality assurance to check that we are actually running our tests up to par, that are up to standards. Quality assurance, quality control, external quality control and quality assurance programs. Yeah.
You know, that's one of the things definitely that comes to mind when we talk about quality assurance, because for the most part, especially when it comes to our lab work or medical on a whole, a lot of our people actually try to leave the country saying that they're going to get better health care elsewhere. And and Kev asked a very important question, and not competition, but where do we rate, especially in Central America, in taking care of business, especially this time?
Well, I guess the Ministry of Health, Dr. would be able to more to comment on
Yes,
these things.
we have, in the past 2 years, we usually send most of our samples to CARFA for testing for dengue. CARFA is our referral laboratory in Trinidad and Tobago.
Oh, okay.
See. So it's a referral laboratory for all the regions, especially the Caribbean. So in the past 2 years, we were referring most of our samples for Zika, dengue, chikungunya testing. But recently, since last year, we are able to do it on house. We are able to do what Mr. Elwin was explaining, the molecular biology testing, which we replicate the DNA and RNA of the virus to try to detect it in a small amount of quantities to be able to detect if there's presence in the human that we are, the patient that we are examining.
We still, do we still not have, and I don't know if this is connected to the area that we're currently discussing, but do we still not have the in-house capability to do DNA testing? And why not? And why is that not something that we could actually
yes,
in country?
Yes, you're correct. We're not able to do that as yet. And what I was just explaining, that we recently got the molecular biology unit in Central Medical Laboratory and expanding, and it's doing. We're doing what it's the more important things or the priorities for the country. And one of the priorities for us was to be able to detect the Zika because of the implications that it has to a pregnant woman and then unborn child.
What is the cost implications for sending these samples outside to the Trinidad and Tobago laboratory?
Well, it has a cost, and it's a very expensive cost because we do send it through DHS, DHL, and so it's a box, and they weigh the box, and then so it is expensive. It runs out to $250 to $300 if you send a package, right? And now we're not sending those packages anymore. We are saving that amount of money on sending it because we are able to do it on house. But maybe it's not only the money, but also the ability to give the test and the result right away in the house. We were able to test some samples for last year's influenza, and within 24 hours or 48 hours, we were able to tell the people that in Corozal there was a outbreak of influenza. In the past, it will take us 2 weeks.
What?
If we were lucky to get the results.
The results at the time.
So it's a very exciting place for the laboratory service, for all the professionals. They should be feeling proud of what they do, even if it's not it's not on the front line. It's in the back, but they are doing an excellent job.
You know what, I have got to say, just like as you mentioned, it might not seem as a frontline job, when in reality it is. You know, it saves lives. It detects what's going on, especially in our country. And it leads me to Miss Makin. It leads me to Andrea. Now, Andrea, we're seeing a lot of students in in all these aspects of work. When it comes to our country and the educational aspects of things. Now, as a supervisor, are we seeing students venturing off now into laboratory work, trying to make our country an even better place with lab?
Well, so far, we have been seeing more students than before doing internship. And at KHMH, we started to welcome students doing the internship from last year. And this semester, we have 3 who has been doing internship with us. At KHMH, we only do the chemistry, serology, hematology, urinalysis, blood banking mostly. And Central Lab is our referral lab. Whenever we do get a reaction anywhere that we cannot confirm it, we send it to Central Lab as a confirmative testing. And I believe that those students are evolving in those kind of career, even though it's not a career that grow like business, like any other careers, but it is growing little by little.
Do you think that we need do you think that we need more people venturing into it? And why would you say that?
Well, actually, we do need more people venturing in those areas, especially that the country is having more population, and especially at the hospital. Every month we attend to like at least 2,000 to 3,000 patients monthly.
Wow. And about how many persons work in laboratory services?
We only have one person per shift, and attending to the whole entire hospital.
And that's for the entire country, or are
Yes.
KHMH.
Yes, the
KHMH.
whole country.
And
Do we have referral patients from north, south, east, and west?
do we have the information for the total number of persons working in laboratories countrywide?
Countrywide, in Central Medical Laboratory, we have 42 persons working in the laboratory, plus some administrative personnel as well. In the district laboratory, in average, we have 6 laboratory personnel working. But what Ms. Makin was explaining is that in Carl Husner and some of the other district laboratories that work in a hospital setting, they need to cover 24 hours. Wow. Because if you come in with an accident and you need a blood transfusion, they are there. They are there to do your cross-matching, to prepare your blood. The blood that you're going to receive when somebody donated, they're going to prepare it, and cross-matching is making sure that you won't react against the blood that you're receiving. So they ensure that that blood is compatible with you. And so that's very important. So they have to cover 24 hours. Because
We don't take this thing for granted, you know. We assume, okay, we give blood.
That's true.
And it goes in our fridge somewhere like milk. And then when you need it, you take it out and you just apply it. But this seems to be a lot more involved scientific process that we are completely ungrateful for, it appears.
You would be surprised to know that I believe that there are more lab techs behind the scenes than there are pharmacists or other workers. We are in Central Lab, we're about 30, a staff of 30.
No,
Well,
49. Texas, we are 20.
20 that is for Central, what we would consider the referral lab, also the Central Lab. And as Dr. said, in the districts, in the hospitals, then there is a staff that has to be working 24 hours. Central Lab only works Monday to Friday as we are the referral, but in the districts it's by shift.
Yeah.
So it's a very...
What kind of qualifications does a person need to be working in the laboratories at the different positions that are available? So if I'm a student out there looking at this thing, boy, I finally get to do CSI in Belize, and to be like Dr. and Miss Makin, what kind of qualifications am I looking at? What should I be studying?
It depends of what you want to do in the laboratory. For a phlebotomy, they do CSEs and high school level, and then they get a training on phlebotomy. So that's basic. For a medical technologist, and maybe Mr. Elwin can explain, but they go to university, and recently they are doing the bachelor's degree as well in laboratory. And for me, I'm a medical doctor and a specialist in pathology. So for the pathology unit, then you need to be a pathologist. So then that you need to be a doctor first, and then study pathology.
Specialize
and for forensic, it's even more, because then you need to do forensic as a subspecialist.
As a what
So,
specialist?
Subspecialist. So you have to be a
Specialty.
doctor, and then you have to do pathology, and then you have to do forensic if you want to do it. If you want to be a medical forensic.
I'm sure the money is awesome.
But it depends so it's a very open and broad to all the students that are listening. The possibilities, it's endless. You can, as long as you are eager to study and learn, there is place for improvement and get educated.
Let me comment on what she said about UB. UB is currently on a bachelor's program now. Years ago, when we were when I went to UB, it was only associate.
Associate's degree. Yes.
And well, I have the privilege of being one of the first cohorts of the bachelor's program.
Wow.
We just completed it in December. We're to graduate now in June. And there is another crowd, another batch that is doing the bachelor's as we speak now. And the UB is fading out the associates, and we're going directly into a bachelor's program for medical laboratory science. It is now.
Sorry, go ahead.
And as Dr. said, the possibilities are endless, because we don't have to be just a tech. We can specialize in these areas that we mentioned before: hematology, serology, chemistry, blood banking. There are master's programs in chemistry, master's program in molecular biology. All of these things, and we can even go up to being with the doctorate degree in pathology.
I want to go back to the state of laboratory studies in Belize, or services in Belize. I would assume that there are three aspects to it. There's the expertise, there's the personnel, and then there's the actual infrastructure. What are the challenges in each area in terms of, what are the challenges in terms of expertise? Do we have any? What are the challenges in terms of infrastructure, equipment? Do we have the technology and the equipment? Or are we using, like I know in some other areas, using equipment that's probably from 1990s or the like? Where are we in terms of the infrastructure?
As I said, we're in a very exciting place right now at the laboratory. We are going to be remodeling the infrastructure, because if you're not aware, I think it was destroyed in fire some time ago. And so the remodeling took some time, but recently with some international help, they're going to do it again. They call it remodeling, or refurbish the infrastructure, which will make a lot of difference, because we need to move microbiology that it's in another structure. We will put it in the third floor, and that is something that will happen in this year, I hope, or into 2020, but it should be by 2020 we should have it done. Now the equipment, we are in very good place now with equipment. We are buying new equipment, and not only in Central Medical Laboratory, but also in Carl Huesner. Carl Huesner recently got new equipment for hematology, chemistry.
Modern material.
Modern.
Like they're using in Las Vegas and
correct. And also in the district laboratory, Ministry of Health has supported us on making sure that we are standardizing all the equipment. So all the laboratories in the regions and the districts have new chemistry analyzers and hematology analyzers as well. So, and we are also making new laboratories. Santa Teresa has a new laboratory. San Antonio has a new laboratory. In the north, we're going to put a new laboratory in Chunush and San Narciso. So very exciting, very exciting. We are doing a lot of improvements in the laboratory. Now the expertise, that's where UV is, it's all going, I think it's all going together as we improve and build on the capacities, because UV has, as Mr. Rodriquez was explaining, recently put in the bachelor's degree.
So as we expand, we get more students in, so it's actually working the way it is supposed to.
Yes.
Excellent.
Yeah.
How did you guys choose the different, you're naming the different places that you have substations, I assume. How did you strategically choose those areas, Chinoch, and these different places?
Well, it's through Ministry of Health. There is a planning unit run by Ms. Bell. Ms. Belt and her team, they strategize on what areas in the country are not really well covered or needs to expand and cover more. They did that, and we expanded the south, which is Santa Teresa and San Antonio. And so after that, we, with the help of UNICEF, we embarked on getting international help to also give us some of the funding for these laboratories.
Okay.
And in partnership with, very good partnership with Ministry of Health, then they decided, well, we need to also put attention in the north, and then the remote areas like Shunush.
Yeah. Okay. Yeah. Well, we know that we have got some demonstration that we'll be doing in a few. And Kev, I know. We'll be doing some demonstration of exactly what lab works really are. And it's something that I think is very, very exciting, very important. But before we go there, normally when a week is being celebrated, like for instance, we've got here Laboratory Week. There's normally celebration on it. Is there anything that that is going to be done to celebrate this week?
Ms. Makin?
Well, actually, we at KHMH, KHMH have been supporting our staff for the whole week event. Yesterday we did have an opening ceremony at KHMH, 10 o'clock, and today we are here at the talk show. And tomorrow we are going to have a health fair at KHMH parking lot. Okay. It starts at 9 o'clock and it finishes by 3 o'clock.
All right.
And all the public is invited.
Yeah. Okay.
We're going to do free testing, we're going to have games, food. We're going to celebrate their professions.
Excellent.
And the theme this year is Get Results.
Get Results.
Why is that an appropriate theme for this year, and what does it mean to the Belizean public?
Well, I guess that Get Results means that you know the importance of acquiring your results. It is very important for you as a patient. It is important for the physician so that they can diagnose you. Because yesterday I heard a phrase from a doctor, and it was very refreshing to hear a doctor say something like that, because sometimes they ignore the fact that without the laboratory they can't do much.
The doctors are not appreciative.
No.
What? That's what you just said.
But she's part of the
They
are.
Wow.
Well, this is why it is important to the awareness of that not only the public but everybody.
My director will defend the doctors now.
Because we're a team. We're a team. We're supposed to work in a team.
Definitely.
And Doctor, one of your team members is saying, man, you know,
No.
Well, at KHMH, I believe the doctors and ourselves, we work hand in hand, because whenever we do find a critical result for a patient, especially a patient coming through emergency room, and we have critical result, we call them directly and they are quick to respond. And that way, like, I believe those doctors at KHMH do appreciate what we do.
And they rely on the laboratory, and not only the response, like get results, get accurate results, get prompt results. Yeah. You know, so they do.
Yeah, that was interesting. I noticed the theme for this year didn't qualify how the results are gotten. It's not get quick results.
Correct.
Or get
it's a general theme.
Get results.
Get results.
And I was wondering if there was a reason why the theme did not include a specific focus, or get results now, or get local results, or whatever it is. I wonder why it was just get results.
Get results, it's like I was explaining, it's the whole theme for the week internationally. So they put this as we are the laboratory technologists who give results. Okay. But behind the get results is the get results promptly and accurate, and with quality, that we know that we are what we are saying. It stands here and it stands in the international.
So can we join with the doctors in saying that we, the public, appreciate the work that the lab techs do, and we're doing it on national television?
Yes,
and from our hearts, because we really rely on it. And you know the reason why I don't discount what you're saying is because a lot of times when we get services from essential people, the police, or from doctors, or from the lab techs, we take it for granted, and we're sometimes grieving, sometimes we're happy, we just had a baby, or we're grieving, we just had an injury, or something went wrong, and we don't take the time to come back and say thank you. So I appreciate the result that I like for the public to give to the lab techs back is simply to say thanks.
Not everybody actually. Sometimes patients do come back and say thank you.
I am one of those who do, but the general population, a lot of them are really caught
probably
up
like
in
only
the tragedy
5%.
or the ecstasy of where they are.
Yes.
All right. So let's move on over now to our area whereby we'll be. Okay. So in just a few, we'll be heading over to the area so we could see exactly what happens when we're in this laboratory, how your blood is being extracted, how it's being taken care of. So that's what we'll be seeing in just a few.
John will be extracting blood live.
We could move on over. We could move on over. And I'll be following along because I am not sure what happens when you're in lab, but we've got the professionals in to tell us exactly what happens and how it happens. First and foremost, we need to know what are the equipment we're working along with. We're working with here.
Okay, this is the centrifuge that we do spin the sample. Before we do spin the sample, we have to extract a sample from a patient, which will be demonstrating Mr. Rodriquez.
Yes. So sweating. That's one of the things. Yes, it was.
Yes.
Yeah, it was earlier. But one of the things that we see this a lot, and we know for a fact it spins blood. So what will we be looking for when we do this?
When we spin a sample, we don't actually just use the sample that we extract from a patient. We have to spin it to separate the sample. We only use the serum for chemistry, serology, and the hematology we use the cells itself, but they have to shake and mix up properly before we test it. And if it's not mixed or separate, it will not give us the accurate result, and the result will be not accurate for the patient. It will be a wrong diagnosis for the patient.
Wrong diagnosis. Wow. Yes. So this you have to be very pay keen attention to. And this equipment?
And this is equipment the rotor we use to rotate the serology, like the quick test, like this CRP, the RPR, the RF, the other little quick testing for the serology testing.
Okay. All right. And well, this one looked like a mug. I don't know.
That
is that's what we're throwing our waste, right?
Yes, that is our waste bag. That is the biohazard. All the sharp piece, the needle, anything that is sharp that we use in the lab, that's where we discard it.
All right. Cool. So are you ready?
Well, since you're not.
I swear. So let's get this process started. Let's get this process started so we could see exactly what happens when you are in the laboratory. So first and foremost, you put on your professionalism.
We put on our lab coat.
Yes, the lab coat first. All right. Then we've got all the equipment in the Ziploc, so we know exactly what's going to take place thereafter. And this is the hard part of, especially for the patient, because having to extract blood. There are some folks who are not able to watch blood. What do we tell a patient in this position? And I think this is important because this is the buy-in process. So what do we tell a patient now? Like me, it's very hard to, because I don't like to see it. So what do you say to somebody?
We have to educate the patient first. We will tell the patient what is the important reason why we're doing the testing or why the doctor requested such a test. Because because everybody needs to do a screening at some point. I believe that all of us are afraid of needle because most of the time patients confuse from the needle that we use with the injection. We don't give injection. The nurses and the doctors give injection.
You just extract blood.
Yes, the blood will just flow freely in the tubes that we use. We don't we don't push anything in a patient's vein or in a patient's body. We just extract. Freely the blood flow in the tube.
So let's do this extraction. Let's see what happens here. You got your equipment. If Mr. Rodriguez is ready.
And then we put on our gloves.
So gloves.
Yes.
Following the coat or following the jacket, it's gloves. All right. Man, whoa.
The thing is that when we're doing phlebotomy, we have to establish the communicate with the patient.
Yes.
We have to try to calm the patient. We have to as she said, explain the importance. I myself, I would talk to you and say, John, well, we have to do this, man. Just relax. Close your eyes. You can close your eyes. Make a fist.
Close your eyes, knowing a needle is going to come. Oh my
Just
goodness.
take a deep breath. These are phrases that you would hear from a phlebotomist, right? To get it done. What?
All right, so let's get this done. And again, I would like to know exactly what we will be looking for. So we'll be spinning this blood, but there must be a reason why we're doing this. And so we've got all the equipment we need. And I want for you to tell me exactly what they are as we go along. And let's go along while we're talking. Let's get the situation dealt with.
I need to sit down.
All right, so let's get a chair. Let's get a chair so he can be seated. All right, there you go. And then
the patient needs to be sitting down.
Comfortable, that's the most important thing.
A little more over this side. A little more over this side. Yes. So they must be comfortable.
The patient have to be comfortable.
All right.
Or you want to come to this side?
Any which way do you choose a particular arm? What do we do? What do we choose here?
Well, first we look for a vein. We just don't go stick a patient. We need to find a good vein.
Let me see if I have good veins.
Oh, you want to try?
I know. I'm just seeing if I have good veins.
And if we can't find on this arm, we go to the next arm.
So would you say this is a good vein?
That's a perfect vein.
Oh my gosh! Okay, let me do it. Oh my God! I don't normally do this, but it's important. And and the reason why I'm choosing to do it is because there are a lot of people who feel just like me, and we need to know and understand the importance of dealing blood work. So let's go.
Okay. First, we greet the patient by "Good morning, sir." We ask your identification, and in this case, your name is
John Palacio, Mr. John Palacio.
Okay, Mr. John Palacio. Today we'll be doing a phlebotomy. The doctor, if you bring us the requisition form, and we tell you what test you'll be taking. Then we go look for the vein.
Right there.
And
a big vein. That's a good one.
And then you make a tight fist. Make yourself comfortable.
Yes.
Right here. Then
just relax.
Just relax, sir. Don't worry. Don't think about it.
I can't say I don't think about it. It's difficult not to think about, but this is a very important process because I am somebody who I don't like to do it. So for today, doing it on air, I don't want to say on a historic day. But it's important for folks to do it. So
actually, this part is actually a pre-analytic process phase. We have 3 phases we do in the lab. The first phase is the pre, and then the analytic, which is the testing itself, and the post-analytic is actually the issuing the result.
Okay. So she's disinfecting the area.
So so it's about disinfecting the area. So that's my second step here. And then I would have to turn away because I don't like to watch it at this particular point.
While she's doing it, talk to me.
Okay, well, so in my mind right now, the process is actually about to being pricked with this needle. That's my thought. So
now, you see, that needle, there are different sizes of needle, and you're using a 21 gauge. Okay. There are bigger needles that could comfort you. 21
sound big too.
No. The higher the number, the smaller the gauge.
Okay.
So we are using a 21 gauge needle, a Vacutainer.
Let's do it. We could do this. We could do it. Let's go.
You ready?
Yes, I'm ready. Okay.
Keep the fist.
Just keep it tight.
Cool.
There we go.
It's not as bad as I thought.
You see?
Yeah, sorry.
Kevin's next.
Okay.
That's it?
Open your fist for you, sir. Open it and then you open
Put it up. Hold it up for. You have to hold it up for almost 5 minutes, and it will.
So it will stop. It will stop. And then last thing we do label the tubes and with the names of the patient.
So John Palacio, JOHNPALACIO.
We always label a sample in front of a patient, so the patient will know that actually it is their sample. We are not going to confuse their sample with other patients. Yes.
That was like 3 or 4 seconds or less.
It doesn't take long.
Oh, okay, you know, sweat me though.
It doesn't take long to do phlebotomy. It's just that, like yourself, you're so afraid. Well, all of us, including myself.
So am I able to stand now? Am I able to stand?
yes,
you can.
All right. So my blood has been extracted live on here. Man, that was nerve-wracking, but very easy. So what are we looking forward to now after we receive the sample?
We wait for at least 5 to 10 minutes for the samples to clot.
Okay.
And then after that, we centrifuge it for 10 minutes.
Okay. So we know that in terms of time, we won't be able to have the entire time to do it. But we so far have seen the equipment. We have told you exactly what they're for. We've shown you the actual process of extracting blood and how easy it is or how quick it is. And I will say again, I am very afraid to give blood, but it's really, really, really not a hard process. If you get in the position to, then it's best that you do, because it's very important that you know what's going on with your blood and your health.
After the centrifuge, this is how the sample will look like.
Okay.
It's separated. The gel separates the serum with the cells. It's the serum we use to do the testing.
Okay. All right, so there we go.
One demonstrator to do the
All right, so let's do a quick demonstration of exactly what happens in the spinning process, really quick, because time is actually flying by. So let's we could do that.
We're going to do the RPR.
Oh, that's what is RPR?
It's a rapid plasma region testing, which detect the Treponema pallidum testing to see if it's the bacteria present in the patient's serum.
Okay, and that's not mine, being that mine is sitting here and it has to be a 5-minute process.
All that she said is a rapid test for syphilis.
Okay, cool.
That's that's easier to understand, right?
Rapid test for syphilis, cool. All right, so that's what's going on. I hope we're getting this. Okay, all right,
usually
so
put 1 drop, which is 50 microliter.
1 drop. And if you're noticing that she's actually going through the proper process, now the equipment that we don't need has been disposed of.
And then we put the antigen to mix together.
Okay. All right.
And then
So that we're mixing. All right. So there we go.
It's already programmed to 8 minutes for the specific test, and we start to rotate it.
Oh, so all it does, it turns the liquid around.
Once if it's reactive, the testing itself will have particles. Some little fine particles. It doesn't have the button in the middle. If it's non-reactive, you have the button in the middle. It doesn't spread out together.
All right.
And once it's reactive, we usually send our sample to central lab for conformity testing.
Okay. So once it's reactive, simply means that there's a possibility.
Yes.
And then it's sent to central lab where we would do further testing, a process called ECLIA. And this would then confirm if the patient is positive for syphilis.
All right. So there we go. It's an 8-minute process. I'm not sure we'll be having all the entire time to do it, but we know now exactly what's done. And is this, when it comes to testing like this, is this what is done only to detect syphilis?
Yes, only the syphilis.
Okay. So all right. So here we go. Yes, you could come around. Ms. Makin, I have to say I feel proud of myself. I've got to say it. But we'll be celebrating this week, like I mentioned. Tomorrow is going to be again. We'll be doing, tell me about the day.
The health fair we're doing tomorrow. All the publics are invited to come around and appreciate what we do behind the scenes. Without lab techs, we will not get our correct result or correct diagnosis.
Definitely. So, and that day entails that we do all these testing. We test, we extract blood. What do we do?
We will be doing maybe blood typing. If you're not sure about your blood type, A, O, B positive, we will be doing that. I guess there will be a bit of hemoglobin or glucose testing, rapid glucose testing.
We We will be doing the CBC, which because it's close by our place,
Okay.
and we'll be doing the chemistry as well.
All right. So we know exactly what's going to be done. There'll be games for the entire family.
Yes.
Where is it going to take place?
At KHMH parking lot.
All right, that's on that one. Good parking lot for you.
Yeah,
And the entire public is invited to come on out.
Invited,
Is there a cover charge or it's free?
No, it's free.
And it's going to be from what time to what time?
It's going to be from 9 to 3 p.m.
All right, so 9 o'clock to 3 o'clock in the afternoon. And this is when you could go on out, get your blood tested, celebrate with our lab techs for the wonderful job that they're doing across the country. Any final words before we leave? Because we've got to go.
Well, my final words would be I would like to thank the KHMH, Belmopan Medical Laboratory, Bowen and Central Lab who have been supporting us for the whole entire week.
All right, Mr. Rodriquez.
Well, I would like to extend an invitation to maybe students, people that are thinking of going into venturing into this profession. It is very comforting to know that you are assisting, that you are helping a patient, someone that is in need. So we need more. We need more people in the labs. And not everyone is made to be a doctor or to be a nurse, but lab techs can also assist in the health of patients.
All right, so we're looking forward to it. And of course, to all our technicians, we want to wish you a very, very, very happy laboratory week. Is that it?
Yes.
There we go. But we've got to go for the time being. When we come back, we've got some more conversation. We'll be joined by folks from the Public Service Unit. Stay with us.